Welcome, everyone. My name is Alan Roth. I'm a practicing family doc and chair of family medicine at Jamaica Hospital in Queens and vice chair of the Primary Care for All Americans Board. Thanks for joining us tonight, and people from 40 states and the District of Columbia and 332 zip codes who are building this movement together. The crisis in primary care is real. I live primary care every day. I know it from my patients, from my friends and families, and others that can't find primary care clinicians. I know it from my colleagues who show up every day to care for people in Jamaica, Queens, New York, one of the most diverse places on earth. But I also hear it from my friends and colleagues every day around the country who are being worn down by the business of medicine and tired and dispirited with little to hope for, at least until primary care for all Americans came along. I've listened to the high-level bureaucrats, the politicians, the money guys in healthcare for 40 years. I know as well as anyone that there is no one in charge. The cavalry isn't coming, and unfortunately, there's no one here to fix this for us. So I'm thrilled that we're going to hear tonight from Jack Ricchiuto. Jack is a nationally known expert on planning and organizing who is going to help us learn about important ways of connecting people, which is the first step of movement building, as I have recently learned. Please stay on at the end while our board joins Jack for questions and discussion. We'll be talking about how you can bring primary care to everyone in your own neighborhood and community. It is now my great pleasure to introduce our moderator for this evening, Leah Gantz, and thanks to the Zoom Committee of Primary Care for All Americans, which organized this Zoom, and all of the presenters, and to Jack Wright, Brian Kaiser, and Patty Armstrong, our AIM Zoom producers. So take it away, Leah.
Hi, everyone. I'm Leah Gantz. I'm a family medicine resident at Jamaica Hospital Medical Center in Jamaica, Queens, New York. And I want to thank all of you for coming tonight. Being here makes you part of this movement as we together learn the tools we need to break the stranglehold so we can provide healthcare for people, not for profit, in every neighborhood and community. Primary care for all Americans. Please take a second and write where you are from in the chat. That way, everyone can see who we all are as we work together to build this movement. To make this movement rock and roll, we have implemented our new policy on culture, tolerance, and respect as we work together to create a welcoming environment where everyone can contribute their unique talents and ideas equally. So no professional titles, please. Let's talk about the importance of being here together, engaged in this work, and the value of those ideas and commitments, which are what will build this movement at the end of the day. We have invited one of our community members, Paul Behrens, who is also a core founder team member with the Healthcare Reinvention Collaborative, to share about what makes him so passionate about this movement. Thank you for joining us, Paul. Remind us where you are from and how you got connected to this movement.
Yeah, thanks, Leah. I'm Paul Behrens. I'm from Anacortes, Washington. I practiced family medicine for 39 years, continuously working to improve healthcare, frustrated at every turn as I watched my practice circle the drain and pull out 3 times, only to be forced by economics to sell out in 2017 to a hospital partner. A good partner, but that still damaged the practice, first with EHR conversion to Cerner, then a second 2 years later to Epic. Both changes reduced productivity, that is the number of patients we were able to see in a day, and added to pajama time, totaling about 2 hours every night. Access is much worse now, and with my retirement, I'm a patient on the receiving end of bad access. Even for me, the future looks worse. I haven't been able to let go of my passion for improving the system, especially through primary care. Last year, I was looking around on LinkedIn, found Medicine Forward, then the Healthcare Reinvention Collaborative found me. I went looking for innovative communities, and I found Scituate, Rhode Island, and then Dr. Michael Fine, and read his book and made a connection and found PC4AA. I realized how important it is to promote this effort to make access to primary care real for every community, the importance of a community base, the need to connect innovators and form a social movement. This is the only way to modify the economic forces of late-stage capitalism that drive everything in healthcare today. Healthcare is supposed to be caregiving relationships supported by a viable economic model. Today, profit-seeking has made caregiving into an afterthought. existing only to provide profitable transactions. That can't succeed over time. Care gets worse, staffing becomes inadequate, sickness grows, costs rise, care becomes increasingly the province of the rich. We have to find ways to come together to change the fundamentals altogether. Nothing less will succeed. Now, we're all in it, all caregivers and all patients. If you think you're not in because you're not a caregiver nor a patient, trust me, you will be a patient one day. Today, a consumer. But the moment illness or injury strike, you're a patient and no longer fully in control of what the system has in store for you. Join us to change healthcare through the only sector proven to increase health and longevity, primary care.
Thank you, Paul. Hearing more about what drives each of us helps this community grow. Jack Ricchiuto is already known to many of us as a friend, as the guy who helped design our facilitator training, and the guy who helped many of our work group leaders brush up on old facilitation skills and learn new ones. Jack Ricchiuto is a writer who teaches good planning to groups collaborating on new and complex projects. A 36-time author, he has spent the last 4 decades working with organizations and communities nationally and globally, and has taught leadership, community building, design thinking, and storytelling in graduate programs around the US. His website is flawlessplanning.org. For tonight, we are here to both teach and learn from each other. We encourage you to ask questions, put them into the chat, and we'll have time at the end to answer as many as possible after we hear from our keynote speaker. We'll try to end the formal program right at 9 p.m. Eastern, 6 p.m. Pacific time. But we invite everyone to stay on for an interactive half hour at the end as we work together to discuss, plot, and plan. Now I'm very pleased to introduce our keynote speaker, Jack Ricchiuto.
Thanks, Leah. It is so great to be here in this group. The energy and the imagination in this group is outrageous. Other words come to mind also, but we're going to stick with that for now. Thanks. What I want to do in the short time that I'm going to be speaking, and it's been true for me since the beginning that for me, speaking is a practice of listening. So I'm talking now just to be able to listen more deeply to you and with you after my presentation. So, so the power of two, let's talk about that. So Margaret Mead, famous quote, many of you are aware, but I'm going to repeat it just as a ritualistic hat tip to her. Never doubt that a small group of thoughtful, committed citizens can change the world. Never doubt that a small group of thoughtful, committed citizens can change the world. It's the only thing that ever has. So that's the power of two. I'm going to tell the story about AceNet in Athens in Southeast Ohio. But before I do that, let me just throw out some names of organizations you may have heard of before. These were all started by 2 people: Eventbrite, Canva. Many of us are big fans of Canva. Google, you may have heard of them, a little company on the West Coast. Intel, Yahoo, eBay, the Beatles, Post-it notes, the human genome, and HealthWagon, which is a mobile health clinic in a beat-up Winnebago run by Teresa Gardner and Paula Mead, 2 nurse practitioners who navigate the hills and hollows of Appalachia, providing free medical care to the working poor. And so that's where the story takes us. In the 1980s, a very dear friend of mine, June Holly, and a friend of hers, they both worked for the university there, Ohio University. They got the idea of starting to do what we later called network weaving, which is connecting people who weren't connected, who had common ideas or thoughts or interests, Now, keep in mind, in the mid-1980s in Athens, Ohio, this was a region, Appalachian region, of abject poverty. It was pretty well known that the prediction, if the past is flawlessly seen as the destiny of the future, right? When the past is flawlessly seen as the destiny of the future, they had no future. But they started to connect people one after another after another. And over the years, they've spread to 32 counties in the Appalachian region, forming networks of worker-owned businesses, 2 incubators. And all of this was inspired by their early research on cooperatives in northern Italy. All they did over those years was link and leverage local assets to do the doable, to do small experiments, which was a process of engagement, not rhetoric. So it was all about action, connecting a farmer and a marketing person, a young marketing person, and somebody who knew a lot about canning to create a little company that could start to produce food goods. And they've incubated hundreds and hundreds. And the capstone of the story for me was some years ago, I was right after the recession in the 80s. And I was doing a project and I was training people in planning. And I had a guy there and he seemed interesting to me, but I finally met him at a break. And I said, "Who exactly are you?" And he said, "I'm the mayor of Athens, Ohio." And I said, "Oh my goodness," because I had lost touch with what had been happening. And I said, "So how has the recession been for you guys?" He says, "Nobody knows there's a recession going on. The only company that's really struggling is Walmart." What the heck is that about? That's the power of 2. So what can 2 people do? And I want to get us in some, we're going to get into, in a few minutes, we're going to get into small groups because everything happens in a small group. Nothing starts in a big group. Even if when I've had community building and I've had hundreds of people or thousands of people in a room, we get in groups of 3 because that's where the meaningful work happens. Things happen from depth, not necessarily from speed. So I want to just mention a couple things about what happens when 2 people get together. Now, groups and communities move in the direction of their conversations at the speed of trust. That's the principle we work from. And I want to name 3 conversations. And I just outlined these in a short video. And if you want the video, we're going to make the video available. But if you want to see the video before it's available, just ping me, find my email through the folks here, and I'll send you a link to the video. It's a 15-minute video on how to start up a small group like I'm doing this week in Cleveland. There's 4 of us. There was originally 2 of us, but we doubled to 4, and we're getting started. And all we're doing to start is doing the 3 classic conversations that start things from nothing to everything. Here are the 3 conversations. So that the invitations conversation, the possibilities conversation, and the experiments conversation. And they're really ridiculously simple. Invitations conversation. Who else should be at this table? Who else should be in this conversation? And that could be anybody. In terms of primary care for all, my goodness, the list goes on and on of the different kinds of people and personas that could be interested, involved, engaged to move it forward. So that's the first conversation. Who else should be at the table? And we ask that every time we get together. Is there anybody else? Is there anybody else? Because what we want to do is start to build and weave the networks of people. That's how innovation happens from the bottom up. I've been doing innovation work in healthcare since the 1970s. And I've never seen meaningful, sustainable action happen from the top down. Cleveland Clinic. Maybe you've heard of these visits. This is a little tiny little nonprofit in Cleveland. I don't know if there's $6 billion or $8 billion. It doesn't matter anymore. It's not real money. They're global, they're worldwide. We started to put together little networks, little teams of innovation. And over the past 5 years, globally, over 400 small groups have formed out of nothing, self-organized teams, starting with twos, to build networks of learning that have helped transform the organization. Bottom up. Okay, that's where the genuineness comes from. A lot of times when we do community building, the powers to be don't even know what's going on. They hear about it later after we're already moving forward. And then they're happy, and then they're excited. And, geez, can we send you money? June Holly, this is hilarious. So June, at the end of her career at AceNet, which is the organization that she and her friend founded, 20 years later, I was coaching her, and she was making her way out of the organization into consulting. And I said, "What's your biggest problem?" She says, and this is the truth, she says, "Funders keep calling me with money, and I keep telling them I'm not sure what to do with it." Funders are chasing her, okay, because that's the power of twos. So invitation is the first conversation. Second conversation are the possibility conversations. What would we love to see possible? What would we love to see possible? And the key is to go out as far as you want to. So when we do this work in communities, we go out, we tell people, if you want to go out 5 years, 10 years, 15, 20 years, it doesn't matter. In fact, going out one generation has a spiritual, social, and ethical significance that going out 2 years never, ever has. Well, how is this possible? 20 years, my goodness, I don't know what my next 10 thoughts are going to be if you're into mindfulness, right? Yeah, yes, this is true. We don't know what our next 10 thoughts are going to be. And you're talking about 20 years. Possibilities are lenses that reveal new possibilities in the present, new options, new opportunities in the present. Possibility awareness, consciousness, is a practice of presence because it makes us more aware of the unseen and the invisible opportunities, connections, and ideas in the present, not to mention questions that can help move us forward. Possibilities are lenses, not locations. They're not goals. They're not endpoints. They're not points where we're done. Okay? There's no doneness in this work. So that's the possibilities conversation. When we get together, we keep asking, we go over that question. These are iterative questions. Who should be here? What are the possibilities we would love to see possible? And then we use those to inspire small experiments, doing the doable with what we have. This is asset-based healthcare transformation. Okay, we've got 2 nurse practitioners, a retired school teacher, a couple of docs, a couple of librarians, and 3 10-year-olds whose grandmother is really passionate about this thing. That's way more than we need to get started. 2 is fine, but then we're gonna keep growing. But we use what we have. Oh, by the way, there's a little space we could do. And oh, by the way, there's somebody who could mentor young residents, fellows, and young physicians dying literally in hospital systems who just need a small, tiny bridge to entrepreneurial activity, like we're seeing here in Cleveland. One of our 4 people is a young doc who caught the fire of direct primary care, in her case, Lily White, and now her practice is taking off way ahead of its schedule. And so she's part of our 4 people. Who knows what's going to happen? So the small experiments are the small things we could do, small things we could try, things maybe it take a few weeks or a couple months, using what we have. When somebody shows up and says, "I'm really good at grant writing," well, get busy, right? Good for you. We love you. Okay, but not more than everyone else who has nothing except talent, time, and some space or some who knows what. Okay. Am I was that a cue? Am I wrapping up? I saw my view changed. How are we on time, Michael?
I think it is probably time to wrap up, in fact.
Excellent, excellent. So anyway, those are the three conversations. I've got the video to do more, but I want to say one more thing. I knew I had one more thing. Storytelling is the way in which we spread and scale enthusiasm and engagement. Telling the stories. Stories build interest, they build trust, and they build scale and spread. And so that becomes a big craft in this process. Thank you.
Thank you, Jack. Does anyone have a question for Jack? If so, please post it in the chat. By joining and learning how communities can provide primary care to everyone and bringing one new person or more each week, we'll build this movement together. Anyone on here that was invited to come for the first time tonight, please raise your hand or give us a thumbs up. All right, great. So our work groups still need more people to roll up their sleeves and be a part of the work we're doing. Please click the volunteer button in the Contact Us section of our website to tell us how you can help. Together, we can make sure that everyone in these United States receives equitable healthcare and gets equitable health, regardless of where you live, how much you earn, what community you come from, or what you look like.
Thank you so much, Leah. So I'm going to open up my chat here and see if we have any questions that are coming in and through. Jack, I've got a few questions for you as well, and just wanted to see if anyone has anything. Hold on one second. All right. Well, let's jump into a couple of questions that I have. Now, I get that this starts with one other person from the community, but how do we get to 20 people, and about how long should that take?
That's unknowable. It's absolutely unknowable. You start with 2 or 3 or 4. You use the three conversations, and you start to build traction, and that's going to get attention. And as long as you keep iterating with those 3 conversations, you're going to grow, possibly faster than you expect. But that's all. There's no magical timeline. Yeah.
Okay. Well, I mean, that's fair. I think we're also used to measurables in the works that we're doing, that this is really, it's challenging, right? To start thinking about this in a totally different way. This is so relationship based. And speaking of like relationship based movements, are there other community organizations that we should be looking at including, and how do we find them? What are some of those questions that we should be asking?
You're talking about in terms of finding communities?
Right. Like, are there certain groups that tend to do well with something like this? I know that Michael has mentioned Rotary Club
Right.
as being a good starting point. Are there other organizations like that that people may already be a part of that would be good to sort of pull into this conversation?
Yeah, I think Rotary Clubs is a really good one, because you're going to have employers, and there's many employers who have an implicit motivation to support primary care, because a lot of employers have given up on the system, right?
Right.
Including insurance. They're looking for an alternative, and they're looking for a way. One of my favorite stories, I think this came, Larry, from you or one of our friends. I'll try to tell it real quick. But the story is that a guy who owned an apartment building, I think Arizona or Nevada, he kept losing tenants. Why is this? Because he found out because they're losing their jobs. He ends up serendipitously talking to one of the main employers there. This is really important. And he says, I'm losing people. The doc says, how about if I move in and I'll just charge everybody this monthly rate? Everybody gets health care. The building owner said, I'll underwrite the whole thing. Right. And so
Wow.
now we have a whole team in a building. Everyone gets free health care, and the employer isn't losing people anymore from work, and the apartment owner isn't losing tenants. So it's right. It's creative things like any group that, you know, the small practices, small family practices. I'm telling you, in every community, the librarians know everything and everybody. No one
Right.
knows this. It's a big secret. And so just getting them involved, it's really the least reasonable or predictable characters. Okay.
Mm.
The retirees, and especially people on the ground, people who see, we have a nonprofit here in Cleveland called Caregivers to Courage, and they support caregivers. These are at-home people who are unpaid caregivers, and they're all over the country. These people are dying to know what we're doing and to become involved.
I think that's a great thing to land on. One other challenge that we want to put out to people, and maybe something that we can discuss a little bit further, is in a climate where everything can become politicized, you know, how do we enter into conversations without entering into fights? And I think that's a great challenge that we have really been pushing for, because when I hear us talk on these Zoom calls, it has everything to do with the individual and them receiving care. And it's not a political conversation, but they very quickly can turn into that. So perhaps we can continue that in our discussion, because we are all out of time for questions. But I just want to thank you, Jack, for your insights and your encouragement to work small, and to see how that really makes working small doesn't mean small movement, it means big movement. So thank you for that.
Thank you.
Michael?
Well, first, I need to mention that it was Pat Tokars who brought Rotary to our attention. And we can't thank him enough for that. You know, certainly we'd love to hear and be connected to Rotaries around the country, because there are lots of opportunities to go and talk to them. And it's a great place to start a conversation. Jack, that was a great presentation. You know, it sort of teaches us that of the hundreds and thousands of people we want to involve, the way to start is with one. That there are assets all over the place. And those assets are community organizations, mosques, churches, and synagogues, Rotary and the League of Women Voters, FFA and social clubs, barbers and hairdressers, Girl Scouts and Boy Scouts, just everybody. You know, every organization in a community is a potential asset. And one of the things I've discovered, and I suspect you guys have discovered too, is everybody kind of scratches their head about healthcare and would love to hear from somebody who's got a coherent and intelligent and practical approach to this, understanding that the cavalry isn't coming, nobody's in charge, and communities really have the ability to do what they need to do to get this thing moving. And you know that we are filled with possibility, and the possibility are all those people and all those community organizations and all their ideas, because each community will do this differently, and we'll get new ideas from each community as each one figures out how to provide primary care to everybody. You know, it feels some days like movement building is a crazy, huge undertaking. But Jack, I think you sort of told us how to do it, person by person, and place by place, one little step at a time. Remembering that health care impacts everybody, so it gives us a place to stand as organizers. And it gives us the opportunity to invite others to work with us, because when we have those others, there's nothing we can't do. And reminds us as well that we need to invite everybody, families and colleagues, friends, your patients, if you're a healthcare clinician. You know, I'm a great believer and did this for years. It's kind of how we started the Situate Health Alliance, by talking to patients in exam rooms, just letting them know what's what. I have a couple of asks of this group. One is to, if you know somebody who wants to help us write the local work group playbook, We're getting started on that. Please let us know. Please let us know if you're interested. We need your help. And then please consider making a small, regular financial contribution if you haven't already done so. It's really hard for me to ask people who have already done so much to give just a little more. But on the other hand, it's kind of important to pay it forward and help us change this mess. And you can do that by spending the amount you spend on a cup of coffee every day, or, if you get income from healthcare, think about donating one day's income to primary care for all Americans, so the people coming up don't have to suffer the moral injury and the embarrassment that all of us have survived. So let's reach out to everybody, to colleagues, families, friends, patients, everybody, remembering at this moment that this isn't a Republican thing and it's not a Democratic thing. It really is an American thing. It is healthcare for everybody, for people, not for profit. The time is now.
Over the next 2 weeks, many of our work groups will meet and keep working on different projects, from writing our playbooks to doing social media to organizing in our states and communities. If you don't have a work group yet, please put your name in the chat and we'll help connect you to one. We encourage everyone to bring someone new to our next Zoom meeting on August 13th. Better yet, bring 6 or 7 new people. To adjust for the summer schedules, we will meet only once in August, on August 13th, to hear from a number of great speakers about how to connect and build strong bridges with community organizations. So come one and come all. Register on our website, primarycareforallamericans.org. And while you're there, click Volunteer in the Contact Us section of the website to tell us how you'd like to be an active part of our movement. And please click Donate to support our work together with a contribution. Every little bit helps. We need and appreciate every single one of you for helping to spread this movement across our nation in order to get the change we need and you deserve. Healthcare for people, not for profit. Primary care for all Americans.
So I just dropped the link in for completing our survey. We can only get better if you tell us how to get better. If you would like to talk with members of our leadership team or with Jack, stay on our call, and members of the board for PC4AA will stay on to hear feedback, help us grow as a community. Thank you, everyone. And again, we will see you on August 13th.
Patty,
Yes,
aren't
sir.
we going to break into work groups tonight to talk about what Jack just said?
Yep, we can break into work groups now. If everyone here is still on, Jack, did you want to give any more information on that?
Well, if we want to do, we can do a 10-minute group if we'd like to.
Yeah, let's see who's still here and we'll hop into those. John, are you ready to launch the work groups?
Yes, I am. If people are going to stick around for the 10 minutes and then a little debrief afterwards, then we'll break out into enough rooms that everyone's in 3 or 4 per room.
Great. Sounds
Jack,
good.
do you have some instructions for us about what to
Yes.
do in those work groups?
Very simple. Yep, 10 minutes. So we have small groups, and there's one question, very simple question, and it's a brainstorm of what could 2 people do? What could 2 people get started? What could 2 people ignite or spark in a community? And just brainstorm that. Okay, come up with as many ideas. Discuss none of them, because more ideas lead to better ideas. Discussion never increases the quality of our ideas. I know that sounds really heretical for some of you, but it's from a neuroscience point of view, it's absolutely true. So we're not debating or discussing, we're just coming up with as many possibilities. If you'd like to come up with bad ideas as well as good ideas, I dare you, that's a dare, because you will not come up with bad ideas. So good luck trying, or just come up with good ideas. So we'll see you back in 10 minutes. John's got us, look for your invite from John on your Zoom screen. You should see a little invite to a breakout room. it'll say John Wright is inviting you to join room something. And you can just go there and we'll see you back in 10 minutes. And then John, if you could broadcast the question again. Right? What could two people start in a community? And then people will have that.
All right, the message has been broadcast. People are going into their rooms.
Thanks so much.
I'm just going to move people now if they haven't already done it.
Yeah.
Because some people might be on phones or having trouble.
Yeah, very true. Some people step away.
Actually, it looks like almost everybody's gone. That's good.
Yeah, it's good.
I never got an assignment.
Ah,
Because you are a co-host, so I left us off.
right.
Okay, you want to assign me someplace?
Yeah. Where would let's see. I'm gonna assign you to room 6.
Thank you for that.
Great. Thanks, Michael. So that should put us at about, what is it, 18 after the hour?
Yeah.
So, right,
Yeah.
okay. Okay. Excellent. Good. I never join rooms.
No.
No, never. No, I literally since the beginning of Zoom, and I've run hundreds and hundreds of these because it people defer to me, and you know it turns into a Q&A, and they don't do the
Yeah.
yeah. So
So you were supposed to be, where was you assigned to?
room 2.
You were 2, so there's still 2 people in that room. So
It's okay.
although Bob McCullens has not taken, oh, he's talking though. He's not sharing his video, but that's all right.
That's all right.
And I likewise do not usually join a breakout room just in case someone gets stuck or needs to come back here.
Oh, I
but
know.
can-
Yeah, exactly. Yeah, exactly. Yeah. So where are you located again, John?
I'm in Rhode Island.
Oh, you're in Rhode Island. Okay.
Yeah. Although currently I am at my girlfriend's house in Kingston, Massachusetts.
Oh, okay. Yeah, I'll be up in the Berkshires in a week and a half visiting friends.
Yeah, nice. I will be in the Adirondacks in a week and a half.
Oh, okay. Working or vacationing?
Well, fortunately, a lot of the work I do can be done remotely. So it's Zoom production or editing videos and such. So I hope I can get some work done, but it's mostly a nice place to be on vacation.
Oh, you're not kidding. Yeah.
Yeah,
Especially this time of year. Jeez.
it's the best time. Well, Christmas is nice too. Although when I was a kid and I went up for Christmas, it was always like lots of snow. That was part of the fun. And now it's like, who knows? Christmas, probably not. Probably not.
Yeah, it could be mud or snow. This is very true.
Yeah.
Oh my, yeah. Yeah, I'm not a snow. I love the snow, but I'm like don't do ski or whatever.
No, I'm a fan. The snowboarding mostly.
Oh, okay, yeah. Good.
How did you meet Michael?
I met Michael through Larry Bauer. Do you know Larry?
Yeah, he's yeah,
Yeah, he's on the group. He's in the group.
yeah.
I met Larry through a family doc here in Cleveland. I'm not sure how they connected. And then I've been friends with Larry's for a couple of years now. Yeah. So, and I'm, volunteering, trying to help get the local groups. I'll be supporting the local groups, getting their getting themselves off the ground. That's why I'm starting in Cleveland so that I have a story to tell,
Mhm. You said you've been doing similar work since the 70s?
correct.
Wow.
Yeah, there's a bunch of old white men in this thing, and I'm in that group. I don't wear any cool hats.
Right.
That's the only difference. And I'm not a doc either, so
Oh, you're not.
I am not.
Oh,
I've been in healthcare. I've been in healthcare my whole career, but no, I never. The only thing I still do in healthcare these days is coaching physician leaders, which I've been doing forever, and I really enjoy that because they have no clue how to lead.
Hmm.
And these are great. These are good leaders. They're not great leaders, but they've never really learned how to be a leader, and then now they've gotten into a position where they're over their head, and they really need to learn how to lead.
Okay. I've been told since I was young that I'm a natural leader, and I did go to seminary and got a MDiv, and there's some leadership training there, but I still feel like it's kind of nebulous in my head. Like, how do you coach a leader? Do you have like a 3-point program or 3 tiers of training? How do you think about leadership training?
Well, excuse me. So my approach has evolved over the years, and the last book I did on leadership, the last couple of books I've done on leadership, what I'm saying is that leadership is 100% language. If you take 2 leaders, one is effective, one is not effective, I can dissect their language and tell you exactly why the one does well and why the other one doesn't. And so all I do is work. And so there's actually a methodology called ontological coaching.
Ontological.
Yeah. This is a big deal.
That's
And,
pretty, yeah.
That's the closest to describing the model, which is changing people's language, because all transformation is linguistic. That's one of the principles I worked from for years. Yeah.
The best
Mhm.
the best book the book I retained the most from my graduate studies, again, this was like in a seminary program. I wonder if you've heard of it. It's a Jewish guy, but he's also a psychologist. Friedman. He wrote a book called Generation to Generation. Do you know that book?
I never read it, but I remember the title. Yeah.
It's a lot about like family systems and how leaders have to maintain a non-anxious self-differentiation kind of existence, and you can either pump anxiety out into the system, or you can tamp it down just with your own vibes.
I'm 100%.
Yeah.
Yeah. 100%. Yeah. That's very true.
So you're a writer as well. You it sounds like you're writing books.
Yeah, I could do a couple a year. I've done 36. Of course, I'm working on 2 more, because I'm always working on 2 more.
Huh.
So they've ranged. Most of them, vast majority have been nonfiction. I don't do novels or fiction stuff. It'd be really ironic if I did romance, romance mysteries or romance horror genre or something. I don't do any of that.
I hear that's a popular genre these days.
It is it really, yeah. And there are people who write it very well. So I also have a daily blog on that I continue to do, that one is on community building.
Okay.
So I enjoy that. Yeah.
Well, it's 9:17. I could give them the old 60-second warning.
60 seconds. Yep. We can get them back.
Okay. All participants have been given 60 seconds to leave their
And
breakout
then
rooms.
this whole thing wraps up at 9:30 Eastern. Is that right?
Yeah, I mean, a few people will left at 9 when it's supposed to end, but
Yeah.
most people are in the habit of staying for an extra half hour for conversation. So
Okay.
that gives us a good 10 or 12 minute
Yeah.
debrief. Would you
Sure.
decide? Yeah.
Yeah, sure, no problem.
Cool.
That's good. Yeah, it's fun.
Yeah, I like breakout rooms too.
Oh, yeah.
Carol Lessett, I'm guessing she may not be on anymore. Hi, Carol. Nope.
Some people they come on, they step away, they, they get called away or whatever.
Yeah.
Yeah. Good.
Here they come.
There we go.
Welcome back to the main room. You will find that you're back on mute when you enter the main room. So if you'd like to speak, you can unmute yourself.
Are we going to just all share the ideas from our groups, or? I was in the middle of a sentence when we got.
Oh, yeah, it happens. These are always shorter than we would want otherwise, so. Yeah. Yeah, I don't know what the program at this point is, but thanks for doing that. That was great.
We don't usually have too much of a formal program at this point, Jack. I'd love to hear maybe one from each group just to, see where you guys sort of landed at. And maybe it's not even what you landed on, but the experience that you had,
Yeah.
because that's truly more what this exercise is about, right?
Yeah.
So,
Yeah, that's right, Pat. So that's the approach I always take. So this is not a report out of content. This is what struck you personally from that conversation or in that conversation. And anybody could speak. Doesn't matter. If you don't want to speak, you don't have to. But
I want to speak up and say that my conversation led me to think that my own long experience in healthcare is inhibiting to brainstorming.
okay. Okay. Fair enough. Fair enough.
Well, I think you brainstorm well, we came up with a couple of points, most of the world doesn't know what primary care is, why you should have a primary care physician. And then we Googled, well, I didn't Google because I'm not the social media person, but the other two in our group did. And we found that, we're not doing a good job on social media, and the only way we're going to explode is if we do it.
Mhm. Good.
And the way that we do it, we pick up on Jack's idea of telling stories. You all have stories. The students, the residents, the docs, the nurses, the nurse practitioners, you all have stories. Flood the world the country with stories about what happens when you don't have primary care. You have stories about that. And you have stories about when you've had a really positive experience, either as a patient or as a caregiver.
Anything else struck anybody?
It struck me after just talking to Larry for a few minutes that I challenged him to get one other person in Hershey, Pennsylvania, and start talking and say, how about in 2 years if we present to the Hershey Food Corporation to fund a movement in Hershey to provide primary care to every citizen of Hershey, Pennsylvania. And following your ideas, Jack, it was a crazy idea. It's not,
Right.
We're not gonna do it next week, but if it's 5 years from now or 2 years from now, it's like, oh, well, we can sort of fantasize about it.
That's right.
And just start talking with one other person with that kernel of an idea. And how easy that was just by following the directions that you gave us. So thank you.
Yeah.
I
Thanks.
would have to say, I think that idea is freaking brilliant and quite doable.
Yeah. 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 That would be a great small experiment. Is getting 2 people at Hershey to work with, all right, a few people just to get something going. I cannot stress how important small is smart. Small is fast. Right. Yeah.
Well,
Go ahead.
I did a lot of talking, but I fell in the trap of talking about my idea. But I had actually two ideas. One was that because many people care but are just ridiculously busy, that we need to put together some kind of packet or packets of small tasks people can do to help without having to go to meetings or get involved in time-consuming things. Like, here's this package, send it to this congressperson and to this foundation or whatever to promote this idea with your voice, assuming you agree with it. And done. That's it. The person can do a little thing that actually helps. And the other thing is, I have sent links to a number of people about this, the link to the website, and I've gone to the website myself. Half the times I go to it, it's promoting the meeting that already happened. It's behind. I'm not meaning to criticize anybody. Now everybody's busy, including the person doing the website. But I actually think it's a little overwhelming also. And what I would think might actually help is if there was a link or two that when you hit on it, only one thing or two things came up, not a whole choice. And, you know, it could be story and a list of things you can do to help or questions to answer about why you, whatever it is, it should be not overwhelming, not time consuming, not you have to make a lot of decisions to go further, because I think sometimes simple is better. She says, having just come home from a big supermarket where I'm like, you know, I want one brand and there's like 35 of them. God bless, you know, that kind of thing.
That's how it starts. And I think that's a really important point you're making, which is what can two people do in 2 hours? Right? Can they, and so in Cleveland, one of the things we're going to talk about is how can we get two family docs talking to two high school counselors, right? For 2 hours, period. And you know, Patty, you talked about speed and how do you measure, right? One of the core measurements is the number of new connections made. Okay, because money follows relationships. More than relationships follow money. So just the connecting of people, and that's where the magic starts to happen. As soon as you bring people together, magic will occur in ways that it didn't have before. And so just those connecting, right? You know, a rabbi, it sounds like a joke, a rabbi, a priest walk into a bar, right? But they walk into a bar, right, with a family doc and two librarians. I'm totally serious. And have them to have a 2 hour conversation. I swear to you, something's going to come out of that. Okay? It's making these wild connections that are very simple. And we're not asking people to commit their life away, right? Or abandon their families or their careers. What can two people do in 2 hours? That's literally what we're talking about. That's how all the great movements started. They started with 2 hours, not 92,000 hours. Okay, so we have to keep that scale in mind when we're doing this.
And I think there's something empowering about that. We talk about movement building, we talk about making big strides and bringing primary care to all Americans, right? And it feels really big. It should be really empowering for each of us to say, you know, have a conversation with one person, right? It's not resolve and bring everyone along. It's talk to one. I do this a lot in my job of I go out and have conversations with people about the work that needs to be done, and it means something to them.
Yeah. That's how AA got started here in the Cleveland area.
Oh, that was on our list.
Two guys talking, right?
Maybe we'll start an AA meeting.
Yeah, two guys talking, and then two other people got involved for 2 hours, and it became this ridiculous movement. But that's where it started. It didn't start for all alcoholics. Okay,
You got something important in that thing. I'm an old AAers, so one guy asked the other guy for help, personal help he really needed, and that was part of the motivating factor. So we need to make this personal also more, that it's like, this matters to me. So if the person can't get like motivated by the big apolitical politics of it, they could maybe be a friend to you and say, oh, this really matters to her. Let me look into this and give her a hand with it.
Good point.
Well, we are getting right to that 9:30 time frame. There has been some great discussion tonight. I hope you are leaving tonight encouraged. We are meeting again on August 13th for those of you who have not signed up yet. And really, for those of you that have stayed on for this, sort of off the cuff discussion at the end, thank you.